Oh, okay. Well, I'm already recording. Okay, so funny. Anyway, welcome to the second course in pharmacology, y'all. Several of you are back with me from the first course, and so welcome. We'll be discussing some good things, and of course you'll have a lot more work than you can manage. I would, as I said, maybe on another video, is make sure you review the syllabus carefully, okay, so you know what's happening. And with the reading, especially the downloads, like the gold documents, and some of the documents from the National Lung and Heart and Blood Institute, some of those other places, those are big documents, so make sure you kind of use those as references, especially like when you're doing prescribing for asthma and you're looking at stepping 1 through 6 and how to step up or step down in terms of treatments and disease severity. Use those. Don't read everything, because you can't possibly read everything. Okay, so on those documents, and of course read the textbook, which we're using again is the Lang. I'll just pull it out, but that Lang book, Basic Pharmacology, of course, is going to be the meat and potatoes, and other supplemental reading would be like your primary care textbook that goes a little bit more into pathophysiology of specific diseases. And so I would just, and also do the online modules that have been prepared by Sarah Desmond. So the first 2 weeks we'll be looking at pretty much asthma and chronic obstructive pulmonary disease. In week 3 we're going to diabetes, talk about oral agents and type 2 diabetes on week 4. Week 5 you'll have your first exam, and read the read the syllabus, because I think a couple of these will be not live exams. I believe the final exam will be live. Then just continue to look through the syllabus. I'm kind of flipping through it right now, like week 5 as coronary artery disease, acute coronary syndrome, heart failure. 6 is arrhythmias and anticoagulation. 7 is common symptoms. And then 8 is pain and substance abuse. And that, you should be able to get on that Boston University Scope of Pain site and just go in as an RN and answer those questions. I did the same thing, and answer the questions to the best of your ability, and do that and print out the certificate so we can see that. Of course, that's not till week 8, so you have time for that. I wouldn't rush to that. Then week 9 we'll start into some derm. We have a test too. There's a test and online, and we start derm, which will be a little bit of derm, and then week 10 derm and antivirals and antifungals. Week 11 depression and anxiety. Week 12 we'll talk a little bit about ADHD and some additional topics in week. I think that week 13 is going to be the endocrine, so we'll discuss some other endocrine things that you might see in primary practice. In primary care, and then exam 3 will be the in-class exam. It's going to be busy. I have made our live sessions. We're meeting on Wednesday, so I've made kind of live sessions on Christmas Eve and New Year's Eve as well. So I just created those. I don't know if we're going to amend those or do something different, because I thought, boy, it's going to be tough to have a live session on a Christmas Eve and a New Year's Eve. I mean, I'll be kind of talking to the screen myself. But anyway, we'll have to find out what we can do to make arrangements for that. So that's kind of it. You probably have other questions. I think it's a little different this time in that your course grade will be weighted primarily toward the 3 exams that you're going to have. So meaning that you need to get at least 83% or higher on all those exams to pass the course. So to say it another way, all the other work that you're doing, like the quizzes and the discussions, they really won't lift you above that if you fall short. And then also the discussions, I like to interact in discussions, and I read those, and I research them as well. So I spend time looking at those. I don't just ignore those. And I will respond to those with maybe some additional things that you can think about. And so I'll leave it at that, and I'm going to cut this off now because we're running close to 5 minutes, and that's long enough for a YouTube video. But anyway, I'll see you in class, okay?